So what are some of the things that we can do to increase blood flow? A technology that I recently started using about a year ago is called GAINSWave. GAINSWave uses low intensity extracorporeal shockwave therapy, and it basically can optimize men's health. It can optimize performance. What it does is it creates a small injury. Injury then sends a message to the brain. The brain releases mediators, mesenchymal stem cells, to go to that site and increase blood flow by causing what's called angiogenesis. So actually the GAINSWave treatment, which has been very popular lately, and it's available all over the U.S., we do it in New York City and my Westchester location, but it's involved everywhere, but it's for two things. It basically helps increase blood flow, and it does that by angiogenesis
and
neovascularization.
Means growing new blood vessels. Correct.
So anytime you have an injury, your body is trying to repair that injury. And our natural repair mechanism is stem cells. So you have a cut on your finger or a shave. You're shaving and you have a cut. What happens in 2 days? It's healed. Why does it heal so fast? We have a self-repairing mechanism. So this low intensity shockwave therapy, GAINSWave, basically gives you this small injury. And we're all familiar with shockwave therapy for lithotripsy, right? Lithotripsy is higher intensity for kidney stones. So this is low intensity. So the GAINSWave therapy basically works by angiogenesis, new blood vessel growth, and growth factors, bringing new growth factors to the area. Usually we do a treatment once a week or twice a week. It's about 6 sessions. It doesn't hurt. It's not painful. It's non-surgical. It's not invasive. Patients see results, significant. We're getting great responses. And usually we do 6 treatments or 12. Some people have Peyronie's disease, which is a plaque, a fibrous plaque, an injury to the penis. This has been curing it in patients.
Incredible. That's incredible.
And these are young patients that we're seeing, 30s and 40s. Some 50s and 60s, but we're seeing some great results with GAINSWave therapy. So
does it when you get like 6 or 12 treatments, is it a temporary result or does effects are longer lasting?
We're seeing results lasting up to 2 years.
It's sort of like having a cardiac bypass in a sense, right? You get new vessels.
Well, yeah, not exactly. I mean, that's the mechanism of it. Let's say you exercised your whole life compared to someone who was sedentary their whole life, and you both had a heart attack.
Yep.
From the books, remember some of these studies, the person who exercises is going to have a smaller heart attack. The person who doesn't exercise will have a larger heart attack. What does exercise do? Grows new blood vessels. So, if someone who exercises a lot, who has some blood vessel growth, but sort of like is having a lot of ED issues because they changed their diet, they have some inflammation, and their blood vessels are kind of like constricted. This will help knock off some of the calcium inside the vessel wall. It'll increase dilation of blood flow, bring in more growth factors, and basically.
So it's like regenerative medicine for the penis, basically.